In our communities, TB is the most prevailing sickness.
So we know that around the world there are probably about 2 million children who are infected with drug-resistant TB.
If we only wait for people who get sick to come to our clinic and then treat them at that point, we're never really going to make a dent in the MDR-TB epidemic.
To look at the prevention of drug-resistant TB in children. To date, there's been no evidence globally, which means that the World Health Organization could not make a specific recommendation about the prevention of drug-resistant TB in children or in adults.
The trial basically compared an antibiotic called levofloxacin with a placebo, and the placebo or antibiotic was given for 6 months to the children, and then we followed them up for a year after that to make sure, or to look for whether or not the children actually developed TB disease. So the trial was about whether levofloxacin was effective and safe to actually prevent TB in these young children.
The trial was led by the Desmond Tutu TB Centre in Cape Town, South Africa, but we worked with colleagues in Johannesburg, in Klerksdorp, in Port Elizabeth, and also in KwaZulu-Natal.
The trial enrolled 922 young children, and all of these children were living with an adult who had drug-resistant TB.
So there were people who were uncomfortable because they feel like, oh, we are in this house, so these people would think that we're dirty and that sort of thing. But we tried to make them comfortable.
Our drivers drove almost 10 times around the circumference of the earth during the period of this trial. Our recruiting team screened over 5,500 index cases. Our pharmacists completed about 2,500 scripts. Our data capturers captured more than 50,000 CRFs.
For me, this journey started over 10 years ago, and to see the results now come through is hugely exciting.
But there were a lot of other interesting questions that we wanted to ask as well, such as whether levofloxacin was actually acceptable to these families. Was it affordable? Were the families able to adhere to the levofloxacin medication? And yeah, we also looked at different formulations of the levofloxacin and how acceptable it was for young children to actually have to take an adult formulation, for example.
And what this trial provides is information, and it provides evidence that there is a safe and effective treatment to provide to children who have been exposed to MDR-TB that means their risk of developing disease is reduced. And that is a huge step forward, and it equips health workers all over the world with a tool if they're in this situation.